Good afternoon. My name is Rachel Reed, and I'm here with Mary Kozorys, our NDP candidate for the Thunder Bay Atikokan riding. Well, first and foremost, our Thunder Bay Live viewers would like to know who Mary Kozorys is as a person. So if you could give us a little background, on a personal level, would be fantastic.
Great, thanks Rachel for coming this afternoon. I really appreciate that. So who's Mary Kozorys? Mary Kozorys is somebody who grew up just a couple of blocks from here, born and raised in the east end of Fort William. My parents came to Canada as displaced persons after the Second World War and settled into a neighborhood that was a little bit like the United Nations. So we grew up with people from a variety of different cultures and all who shared that same kind of experience. So we were first generation Canadian. And I think, Rachel, what really is so important to me is the fact that my parents, because Canada adopted them, that we had to really prove ourselves that we could be really good citizens and participate. And that's really where I got my start. I became quite active as a teenager with the first or the founding multicultural youth group. And that started into other social engagement, other activities. I went to Lakehead University eventually and graduated with a degree in business, human resources, and subsequently went on, after I had my children, to begin a social work degree, which I'm still a few credits short in completing, but I'm getting at that as well. I'm a mother of two, a 22 and a 29-year-old. Our son is a planner with the City of Thunder Bay, and our daughter is a poli-science psychology graduate. And my husband is a retired prosecutor. And what's unique right now is I have my 89-year-old father living with us. So it's come around full circle.
Right.
Yeah, and with that presents itself with all different, variety of different challenges.
Oh, I'm sure.
Yeah.
So as far as your political experiences goes, leading up until now, give us a little bit of a briefing on that.
I guess, Rachel, my political experience, I'd say the small P political experience began with my community work. A long history of being involved in a number of different initiatives, including the Lakehead Social Planning Council, which I've been involved with for now over 30 years, and presently going into my third term as president. So that type of political involvement has really been speaking with people and looking at issues and building them from the ground up. And in probably around 2009, 2010, I really looked at how I could how I could turn that experience into actually running for political office. So I did run in 2011 and came very, very close, just over 400 votes, which was a phenomenal experience, and really have continued. I guess I haven't stopped my political activity before or after that.
Right, so it was your first time in 2011?
That, yes, formally it was.
Right. So the NDP, they've come out with their platform. Okay, can you summarize just some of the key positions in that platform?
Well, Rachel, it's a platform that really is responsive to the needs of Ontarians, particularly Ontarians in northwestern Ontario, where the cost of living is particularly high. So the platform is really based on those pillars of how do we make life more affordable. We can make life affordable by looking at the basics, the things that you and I need every day. Hydro affects us.
That's a big issue.
It's a huge issue at the doorstep of people, the rising cost of hydro, why it is that we're paying the rates that we are, and why it is that we're still paying the debt retirement after so many years. Then you look at auto insurance. Because of the geography that we have to cover, most people require the use of a vehicle here. Right. And the Liberals have promised in 2011 to look at car insurance rates, and it's a promise that they haven't delivered on. And then we look into the issue of health care, which, again, there isn't a person I haven't met at the door who has not, if they themselves have not been affected by the healthcare system, then they have a relative, a friend, a family member who has very long emergency wait times, chronic shortage of healthcare professionals, and looking at the services that we can offer to keep seniors in their own homes. So it's a platform that addresses that by helping to reduce emergency wait short time, putting nurse practitioners in the hospital setting where they can help to relieve some of that work, and also expanding the number of community clinics. So people who don't have access to a primary care physician could now have that through nurse practitioners.
Right.
And then the other little piece or strand with that is attracting and retaining new medical graduates by helping to reduce their student debt. So again, things are really practical that really resonate with everyone.
Yeah, that's fantastic. Now, like when we were talking about, it's important to get yourself out there as far as a candidate goes, and a door to door again is important, especially to hear the views of the voters. Now, what have you heard most from the voters in the Thunder Bay Atikokan riding, and what do you propose to do about it?
I guess the top three would be some of the things I've mentioned in the platform. First being the cost of living in general. How can you put money practically back into people's pockets?
Yeah.
So the responses, for example, taking the HST off of those items that we use all the time, that would put money directly back into pockets. Looking at this whole, right now we have almost like I like to call it the alphabet soup of hydro, electricity regulation,
Okay.
where we've got so many agencies that are regulating the use of power. So by streamlining and reducing that helps to actually equate back to reducing those costs. The second item is, again, the health care. How can you help me to get a physician? How can you help me to get on a wait list? Is there a better way that we can look at providing community health services? Because they are such a key determinant to the way we live. When we look at poverty reduction, and have had a lot of very, very thoughtful discussions at the doorstep on that. I think people finally realize that those connections, if you feel healthy, if you're eating well, then that's going to result directly in fewer visits to the doctor, fewer visits to the clinic, fewer or less use of prescription or non-prescription medication, but we need to be able to put money back into people's pockets. And the third piece is job creation, and looking in particular at the fact that small business is really the backbone of our economy here. So by helping to invest in those people who create jobs by providing hiring credit. So those are the things I'm really hearing.
That's fantastic. And now you're hosting Orange Saturday. Is that this upcoming Saturday?
This Saturday we are hosting Orange Crush Saturday. We're asking people to come down at 1 o'clock here at the campaign office at 114 Centennial Square to wear orange, and we're going to go out and we're going to have a massive blitz and literature drop. And just mobilizing our volunteers to thanking them for it. This is not the single candidate's election. This is really a community effort, and I've been so heartened by the number of people who have come out to help people. Some people have never been involved politically before.
That's fantastic, and that's going to be at the constituency office?
Here at the campaign office.
Oh, at the campaign office?
Yeah,
okay,
campaign
and
office
at
1 o'clock on Saturday.
That's fantastic. Well, I'd like to thank you very much, Mary, for taking the time out here for Thunder Bay Live. Is there anything else? That you wanted to just let our viewers know?
One thing I'd like to ask and invite your viewers is to look at if a candidate comes to their door, and I know that many other parties don't engage in that, try to have that conversation with them about the issues that you are most interested in, and get out and exercise your democratic right to vote.
Great. Well, again, thank you very much for the time.
It was a pleasure, Rachel. Thank you.
Thanks very much.